size shape. It's kind of in the middle of the chest, I think.
Abnormal.
It's abnormal.
Abnormal.
CDH, this is not a cardiac abnormality. Congenital diaphragmatic hernia. And that's why the heart is where it is. Not uneasy. Not uneasy. But it's a CDH. And the clue is an abnormal heart position. Normal or abnormal?
নর্মাল এক্সেসটা একটু ডেভিয়েশন হয়েছে নর্মাল
Throw some normal cases and just keep you on your track.
হ্যাঁ
Short flips, you don't need more than that. Tell me if this is normal or not normal. It's abnormal. Thank you very much. What is the diagnosis? ADSD. Beautiful. You can no see a beautiful ventricular septum. There's no crux in the heart. There's no offset of the valves. There's no independent mitral and tricuspid valve. The diagnosis is clear. ADSD. Problem here? Shape, size is okay. It's difficult. This is not normal. Look at the ventricular walls. Look at the interventricular walls. Can you see them? Seem thick, no?
ঠিক
Look at the right atrium. It's something thick. It's actually a rhabdomyoma. Yeah, it's a
Rhabdomyoma.
It will become much clearer in subsequent scans later in the pregnancy. So you can already see at this 20-week scan that this is abnormal. We could be going all day. I'm going to stop now after this one. Listen to opinions. Yeah, you happy with that?
No.
Shall I play it again?
Yes.
What training review is normal? Ventricular arterial tract. Where's that nice V shape with those three vessels? Can you see the three vessels? Isn't that nice V shape? How do you show? It's right area. Okay, let's do that live scan, otherwise we'll be stuck here the whole day. Thank you.
Sir,
And
what-
just
what
go
was
behind the screen. Too high, because sometimes you need to really be able to see very crisply the pulmonary veins coming into the left atrium. That was the left atrium. Yeah, with the pulmonary veins coming in. Sometimes you see that little structure there, and that's a coronary sinus, which is normal. Intra-atrial septum, you've got the two secondary septa, the septum secundum, you can see there, and the premium septum is right in the middle of the heart, part of the crux of the heart. Let's see then a picture or a little video. Head is away from you, head is down. Happy with that? Normal, abnormal. Let me just play it again. Short clip. Grows right at the right time. Look at the crux of the heart. Is there something missing there? Yeah? Part of the atrium. That's part of the atrium. There's something missing there. This is a prime atrial septal defect, which is different from an ASD in a child. This is a prime ASD. Ventricular check is just to revise again, remembering that we've got the two ventricles, equal size. We're making sure that there's no hypertrophy in the ventricle. We've seen the moderate band of the right ventricle, and the septum is intact. And we want to make sure that we see the whole septum all the way from the crux of the heart to the apex of the heart. That's the moderated band, always on the right-hand side, which gives the appearance of the right ventricle being a little bit shorter. But actually the ventricular size is all the way to the end there. Compare that to the left ventricle. smooth apex of the left ventricle there, and ventricular sizes roughly. Okay. We have a ventricular septum. See the ventricular septum there? Normal on B mode. Something wrong on the color. Can you see something wrong on the color there? So we want this septum to be complete from the apex to the crux. Nice wide septum. There doesn't seem to be any holes in it on B mode. And then move over here to color Doppler. Nice septum. What's that little thing there? A little flash of light. See that? A little VSD. Muscular VSD. They're a bit annoying, muscular VSDs. Most of them are innocent and will disappear on their own. So don't allow them too much. But this is a muscular VSD. Remember also that the ventricular septum is not only moving from front to back, but also in this dimension. Okay? You need to move up and down through the heart, not just at one level. And that we're going to cover that as we move towards the vessel views. So here we have a perimembranous VSD. See that? The root of the aorta. See a little gap there, and also on the color, perimembranous. And we've talked about the AV junction and the AV valves. One intact cardiac crux, two AV valves, differential offsetting, tricuspid valves on the right, and it's near the apex of the heart. Always remember, tri, which sounds like right, is the tricuspid valves on the right, and near. So this differential offsetting is really important in the diagnosis of an AVSD. Because if you have an AVSD, you don't have two independent valves. Can you see the axis being abnormal in all of those cases? Or the position of the heart? We're still in the fourth chamber. We haven't moved from the fourth chamber. Because now, having looked at the laterality, we've looked at the stomach and the heart, we've looked at the size of the heart relative to the chest, we've looked at the majority of the heart being on the left, look at the cardiac axis. Only now are we going to look at the four chambers themselves. Once we look at the four chambers, we're going to look systematically at the four chambers, and we're going to start with the atria. Two atria. Right and left, roughly equal in size. Foramen ovale in the middle, and a little flat valve. And we can see the pulmonary veins going into the left atria. Spine at the back, right ventricle, right atrium, left ventricle, left atrium. Where did the pulmonary veins drain? To the left atrium. Yeah, IVC, SVC goes into the right. Remember, systemic circulation goes to the right, pulmonary circulation. Where does the blood flow in the fetus? In the atrium, does it go from right to left or left to right? Right to left. Yeah. So the flap valve is in which atrium? Left atrium. Flap valve is in the left atrium. The other thing to do when you're not sure about the heart is imagine you're a red blood cell. Okay? You're a red blood cell coming from the placenta. You travel from the placenta, you're a red blood cell traveling through the vein. Where do you end up? You go through the umbilical vein, you go through the ductus venosus, or the IVC into the right atrium, right? Where do you go from the right atrium? Right ventricle. Out through the right ventricle, through the lungs, or through the ductus arteriosus, back to the left atrium. Or you might go from the right atrium directly to the left atrium through the flap valve. So the valve is opening here. Baby takes its first breath, pulmonary artery resistance drops, and that flap valve closes. Then we have the two separate AV valves. Here we have the separate AV valves, opening and closing normally. We've got an intact middle of the heart, the cross of the heart, the crux of the heart, and we can see the offset of the valves. With the tricuspid valve being nearest the apex. Can you see that? Right side of the heart is the tricuspid valve. Right side of the heart is tricuspid valve. You see the tricuspid is nearer, mitral is further away. Thank you. Move from the tricuspid valve and the valves to the ventricles. Two ventricles, roughly equal in size. To the moderator valve,
আমারটা
the right
AM12
ventricle, see the moderator valve?
Samsung
The right ventricle, thickened to the apex, intact ventricular septum, and normal thickness of ventricular wall. Okay? Happy with that? Be systematic. Don't just sort of look roughly. Like we said yesterday, rough looks not so good. Be systematic. Atria, alveoli, ventricles. But before you look into the heart, remember size of the heart, shape of the heart, position of the heart, axis of the heart. Remember also that we're going to look at the heart in different directions depending on the position of the baby. This is the same baby. Four-chamber view, apical view. Apical view meaning I'm coming from the apex of the heart. A little bit of fallout sometimes in the B-mode image. Ventricular septal defect there? Maybe? I don't know. It could just be artifact. What am I going to do? I'm going to manipulate my probe and move a little bit to the side. Same baby. In the axial view now, you can see that actually that ventricular septum is complete. So that fallout has disappeared. And if still a little bit difficult, you can turn your probe a little bit more and get a basal view, the base of the heart. Very useful view for excluding ventricular septal defects, especially in that perimembranous area, because here you don't have any fallout anymore, anything like that. So all normal hearts. Happy with that? The different views of the heart. I'm not too worried about you remembering what's axial and what's basal. It doesn't matter. The principle is important. You can move around the heart. You do with a different angle of inclination, you get different pieces of information. So, in summary, very quickly, just to revise, two atria equal in size, foramen and valve clip. The left atrium, the atrial septum, the middle of the heart, through the ventricular septum, you can draw a little angle there. And this is the cardiac axis. This is a normal cardiac axis. What's the normal cardiac axis? Easy to remember, 45 degrees. 45 degrees. And the standard deviation is 10 degrees. So that means that 45, standard deviation is 10, two standard deviations is 20. So anything from 25 degrees to 65 degrees is normal. Less than 25 degrees, more than 65 degrees is normal. Cardiac axis. Very important because in many cardiac abnormalities, the first clue you will see is that the cardiac axis is abnormal. And Alfred Abraham suggests cardiac axis as a screening tool for cardiac anomalies. And then we have the cardiac position. Where is the heart? It's in the middle of the chest, as you can see on that image. And then you have differences in this. You can have levo position, as you do on that left hand of image. Levo position, the heart is shifted over to the left. Why is the heart shifted to the left on that top picture? There's something on the right hand side there. Okay, it's the diaphragmatic hernia. Difficult to see because the right side is a liver up. Okay, it looks quite similar to the lung, so that's what's shifting the heart over to the left. Dextral position. Dextral position means the heart is shifted over to the right. It's either pushed to the right because there's something on the left, in this case a pleural effusion, or it's pulled to the right, such as the scimitar. And in the bottom two, you have a different scenario. Here it's not the position that's wrong, but the axis. So on the right hand side you have dextrocardia, so the left side, as you can see from the L, so the heart is flipped over, and in the middle picture you have mesocardia, where the heart is right in the middle of the chest. It should be, of course, predominantly on the left. We've talked about the heart occupying a third of the thoracic area, and a third of the heart is in the left side, right-sided stomach, aorta and IVC. Even if you get it wrong, even if you haven't thought of the baby in the womb, even if you got this wrong, there is another clue on this picture that it's wrong. What's the other clue? The aorta and stomach belong on the same side, don't they? Yeah, aorta and stomach was on the left side, both on the left side. And it's the IVC. Good. Happy with situs, normal situs assessment? So I say, heterotaxy is a whole other lecture. You can watch online. There's a good lecture from Jelani on heterotaxy. We're going to go to the full chamber view, and we're going to make sure, before we start, please, when you look at the 4BC, don't just look at the vowels and the chambers. Before you do that, force yourself to look outside the heart. You're going to look at the size of the heart, and at the front here, we have the umbilical vein. Happy?
Yes.
Remember, aorta is on the left side of the spine. You're going to see some examples where it's not. I will be tricking you as we go through the examination. So once you know, this is then called the abdominal situs. Situs meaning the position of the organs in the abdomen, abdominal situs. Then move from the abdominal situs to the cardiac situs. Okay? And remember that the abdominal situs relates always to the atrium. So, here we have the stomach. Here we have the umbilical vein. The umbilical vein brings into the right atrium, exactly as you see it now. So this is normal situs, normal abdominal and normal cardiac situs. Happy with that? Let's see another example. Normal abdominal situs. See this in the AC. That's all it is. Spine, aorta is to the left, IVC is to the right, umbilical veins in the middle, stomach to the right. Okay, test yourself. What are the white dots? That's the midline, right, left. See the little gallbladder there, umbilical vein right in the middle there. What's the little black spot there? Right hand side, it's IVC, stomach, and of course the aorta. Okay? Once we've worked out the situs, we're going to go and we've looked at the fetal laterality and make sure that the stomach and the heart are on the left. We're going to start looking into onto the full chamber. This is our full chamber view. So we have the spine at the back, opposite the spine, front of the baby, and the front of the baby is the right atrium. Remember the heart is a left-sided organ, but actually it's almost a midline organ. It's like that, and it's just turned over. So the right ventricle is at the front, the right atrium is at the front of the chest. If you have an arrow going through your body, the first thing you're going to find is the right side of the heart. The left side of the heart is behind. Is that okay?
Yeah.
So opposites, always orientate yourself. Where's the spine? Opposite the spine, right ventricle, left ventricle, right atrium, left atrium. Here we are. Nice full chamber view. We can see the normal atria, the normal ventricles, normal size and shape of the heart, the lungs. Normal situs is situs solitus, that's normal. Where you have morphological right atrium on the right side, and morphological left atrium on the left side. So the major hepatic lobe on the right,